Good evening, everyone. You are welcome. Please, if you are presenting, please post your name, the presenter name, and the group in the chat box, please, so that I won't waste so much time. Please, if you are presenting, write your name, and like if you are the group leader, write your name. That's like what we are going to use. We don't want to be waiting for some people. So it will be like first come, the people that are coming first will start the presentation. And also concerning the presentation, you can leave when you are through, but it's good for you to stay so that you can see how other people are doing it. But if you have something very important to do, then you can go. Please, if you're a group leader here, you're presenting, write your name and your group in the chat box, please. Wait, can you all hear me? Like, can you hear me?
I can hear you.
Okay, thank you. And as you're writing your name, please prepare. We don't want a situation where someone will be telling us that he can't find his sliding on his phone or on his laptop or one story or the other. So as you are writing your name, please also get ready to present. There is no link for now. Just hold on. Please, if you are presenting, send your name and your group to the chat box, please. Send your name and your group to the chat box. If you are presenting, you are the group leader presenting, please do that quickly. So welcome everyone. I think it's by 2 o'clock now, then we can start. So, but before then, I would like to read the instructions again because I know some can be quite funny during this period. Some people can be doing something very funny. So I'll be reading it out. You already are supposed to have read it by now, but I'll still be reading it again so that you understand what is expected. Not you are supposed to have understood by now. So they are giving a presentation. It's a 5 minute elevator speech. Immediately is 5 minutes. I'm going to mute your mic. Immediately is 5 minutes. You are presenting your slides. You'll be sharing your screen, either from your phone or from your laptop. I don't know how it's going to be. Then it's simply trying to sell your policy to your stakeholders. That's it. Then you'll be graded based on how well your presentation answers these questions. What's the problem? Why should your key stakeholders intervene? How can they fix the problem? That's that's what we'll be picking out. Doesn't mean that that's how it must be structured, but how well your presentation answers this question is that's what we are looking at. Then and now you are not giving us a documentary, either having a school tutorial. Please straight to the point. No need of telling us long stories. Just go straight to the point, tell us it and explain it well. Then a maximum of 2 group members can present. If you want to have 2 people presenting, but it's not must to have 2 people, 1 person can do it. Then presentation will last for 5 minutes. Then a PowerPoint presentation supposed to have been prepared by now. Then concerning that to third members, it might not work out because some groups are having some funny members. So we just work with those that are available. Then after this session, you can't tell me to do any presentation again, like later in the evening, or no, it doesn't work that way. So these are just the major highlights. Now concerning the attendance, let me make it clear now. If I didn't call your group, like if I didn't call your group name out, like if I didn't say, maybe if I say SCOP 5 or anything, you are not supposed to sign any attendance, if you get my point. You are not supposed to sign in. The form will be open throughout, but you only sign out. We want the names to be arranged, like, I don't know how to say it, to be in an arranged format, like arranged. It's already connected to a spreadsheet. So we already know like who exactly is supposed to be by this time and the rest. So as you are filling the form, if they didn't call if your group is not presenting, please, you are not supposed to fill this form, the attendance form. It's when your group is called upon and the person presenting has started explaining good. That's when you can start filling in the form. Please, I want to make this very clear. If you fill the form before your group members, this is already streamed online. We are going to use it like If you can see, it's already on YouTube, like it's being recorded. So we are going to go with that format. If you sign in, that means it's like invalid. Let me just make it out. Your attendance will be invalid. So let's be careful about that. Any name that doesn't appear where they are group members, like their group members didn't sign in together, it will be like invalid. So please take note of that. If your group is not called upon, don't sign in till your group is called upon. I just hope this is clear. So if there's any questions now before we can start, if there's anything that you're not clear about.
I have a question, please.
Okay, you can ask.
So how about those of us that will be presenting, how are we going to sign the form if we are doing the presenting and others are signing in? Can we sign in after the presentation?
Yeah, there will be a time after the presentation that you can sign in, like the moment. And also, you have already written your name, but I won't tell you to do that. Please mute your mic.
Oh, Tari is even in the middle.
Anybody that is presenting can't be missing. Like your attendance is like very valid because you have like very solid proof. Because if they ask you where's your attendance, you can just tell us to watch your recording. We'll see your name there. So if you get my point, but you are supposed to sign in also immediately after after you have finished presenting, then you can sign in. Is this clear?
Yes, it is. Thanks.
Okay, you're welcome. So I think we can start now if there's no any question. So, and from here, the first group is SCOPI 07, Adeyemo Comfort. But after her, Andrew Egote, that's SCOPI 06 should get ready. But for now, and SCOPI 07, please. Please indicate it. Okay then, Comfort, can you hear me?
Yes, I can.
Okay, so I think please mute your mic, please, to avoid any distraction. If you are joining in, please mute your mic. So I've made you the co-host. You can share your screen. So all your group members that are here, immediately your presentation starts, they can fill the form.
All right. I'll share my screen now. Good afternoon, everyone. My name is Adeyemo Comfort, and I'll be presenting on behalf of Score 7. Our policy topic is food safety. First of all, what is food safety? Food safety refers to all the measures and practices put in place in order to prevent the contamination of food and, by extension, the spread of foodborne diseases. It also refers to the steps that one puts in place to ensure that the integrity and the quality of food is preserved at all stages between production and consumption. Food safety should be taken as a public health priority because safe food equals good health. You can imagine a world where nobody had to fall sick because they ate something contaminated and everyone had access to safe and quality food every time they needed it. So what exactly is the problem? What's the challenge? It has been observed that due to the poor food handling culture of Nigerians and members of the world at large, there have been numerous outbreaks of foodborne illnesses, and there have also been large numbers of deaths. According to the World Health Organization, about 600 million people in the world fall ill every year, due to eating contaminated food, and about 420,000 of them die. Furthermore, children under the age of 5 account for 40% of the world foodborne disease burden, with 125,000 deaths every year. Now, bringing it home to Nigeria, about 200,000 people die every year due to food poisoning. Now, these statistics, these numbers begin to affect you more when you don't think about these people as just numbers or statistics, but as actual people with families, with hopes, with dreams, dying as a result of something that we can prevent. Foodborne risks are something that they're things that we can control effectively if every stakeholder is willing to play their part. So, why do we need our stakeholders to intervene? First of all, we need every hand to be on deck if we will be able to curb this menace of foodborne diseases. We need the health sector, the agricultural sector, as well as the industrial sector, because food contamination has been observed to happen right from the farm, even to where food is being processed, sold, and so on. So every stakeholder has rules that are specifically tailored to their level of influence, their position in the community, and their level of interest in food safety. And so, if any set of stakeholders don't play their role in the promotion of food safety, no one else will be able to take on that task in their stead. For example, if the food regulatory agencies don't implement food safety laws, medical students can't do that for them. And so, bearing this in mind, we call our key stakeholders to action. We implored governments, national health institutions, and food regulatory agencies such as NAFDAC to ensure that the food regulatory laws are constantly updated and implemented at all levels in the country. The government should also ensure that more funding is pumped into food safety research and education, because this is how we would experience more progress in the fight for food safety. Furthermore, food producers such as farmers, the handlers, the sellers, food processors, and manufacturers should see food safety as a personal responsibility, one that they can contribute to with their establishments. They should ensure that their workers come to work only when they're healthy. And this has been found to prevent the spread of foodborne illnesses. They should also adopt healthy food handling practices, such as the World Health Organization 5 keys of food safety. And some of these keys are using safe water to cook, ensuring that utensils are properly cleaned, and making sure that raw food is separated from cooked ones. Food consumers should abstain from consuming spoiled food products and purchase food only from sanitary stores. This would motivate food sellers to ensure that the places where they sell food is always clean, because they would not want their consumers, their customers, to be driven away. And lastly, medical students and MSs should make use of the influence they have in the community and enlighten the members of the community on food safety measures. Let them understand that something as simple as regular hand washing would go a long way in the prevention of foodborne diseases. And so, in conclusion, food safety can and would be a reality in every community in Nigeria if every stakeholder plays their roles effectively. Thank you.
Thank you so much, Comfort. This is a very excellent presentation. This is very nice. So thank you so much. I don't know if Sir Victor has a comment on this presentation. Please, if you join in, please mute your mic. Like immediately you join in, please mute your mic. And it's only Score 07 that are supposed to sign in now. Any other group signing in now is invalid. Please, I've said this over and over again. If you are signing in before your group, you are just wasting your time. It's invalid. So please take note. So thank you very much for this presentation. Thank you so much, and Comfort, for this presentation. It was really good, like very awesome. So I think we'll move to the next person. So the next person on the list is Andrew Egote. That's SCOPI 06. I don't know if you're here.
Yes, I'm here. Please, I would like to share my screen.
Okay, then I'll make you the co-host now. so that you can share your screen. You have 5 minutes to present. Your time starts immediately you start presenting.
Okay. So good afternoon, ladies and gentlemen. We're going to Ndidi Andrew. I'm going to be presenting on my for my group, that's SCOPI 06, that is on strikes in medical school. So given the fact that medical school actually takes a lot of time, about half a decade for you to complete, it is important that we actually spend this particular time acquiring medical knowledge, practicing, and also to get all the soft skills that will be able to enable us to communicate effectively with our patients. So why is it that we have extra time that is called the plus X when we study in medical school in Nigeria? So this, our policy is going to speak about strikes in medical school, why it's how we can actually like curb these strikes, and also call to action to the relevant stakeholders so that they can play a prominent part in ending this menace that has been in existence ever since 1999. Okay, so this is our outline. We are stating the problem, the key stakeholders, and why we want our stakeholders to intervene in this menace, and also how we can contribute to solving this problem. Okay, as I said already, strike is actually a commonplace in Nigeria. We have had over 20 strikes from 1999 up to this date, and they have not. Some of them can take at least 2 weeks, and as the present one we're having over 5 months right now. So it has actually affected the overall growth, because health sector and the medical students are actually an important key role in the economy of Nigeria. Strikes actually reduce the economic impact and also the long-term earning of medical students who have undergone strike in several countries have been found to significantly reducing the GDP, and also reducing the labor value of those medical students. So now, this is our key stakeholders. We try to classify them in terms of influence and also the interest. We have our government in the place of high influence, high interest. We have our strike association, that's our ASU, our NASU, and other organizations as such. We also have our private institutions, the for-profits, the Nigerian citizens. Those are the ones that have low influence and low interest. We have our NiMSA, which has NiMSA, IFMSA, UNESCO, which has significant interest, which has interest and also influence to an extent in this strike in medical school. Okay, so our key stakeholders are going to speak about them. So now, given the fact that we have our government as the major key, as our player in this strike in medical school, they are the ones that our striking organizations are trying to battle with. So we are trying to call them to action in terms of several activities they should actually implement that will make our lecturers or the association to be able to carry out their effective medical education properly, and so that they should not affect the medical education training here. So now, it's possible that the government on their part have not been able to follow up on several negotiations. So we are trying to encourage them to carry out that. And also of interest is that they should exclude medical students, and they should exclude medical students and give them a certain amount of preference, given the fact that medical school takes a lot of time, as well as the fact that the health of the nation is dependent on the doctors, the medical students, and even the medical education we are having in Nigeria. So other stakeholders include the Nigerian Medical Association, the striking factions. They want them to accurately update us on the press of the press releases, and also to engage the government to augment the budgetary proportion towards education, that is UNESCO, to facilitate the training of clinical students during industrial actions. Then significantly, we also have the private organizations and the non-profit organizations. We might want to ask, how do they actually play a role in this striking medical school? So they can actually help us to they can collaborate with medical students to also keep the medical vibe flying, and also they can also help us to establish special tertiary funds for universities. Stakeholders such as NiMSA, IFMSA, student group, MD can send delegates to attend meetings involving the government and striking factions, so that we are not left in the dark with the activities that are going on, and going on about with falsehood and all. So that is actually the end of my presentation. But one thing we should actually take from take from this presentation is the fact that everyone has a role to play, both the medical students, both the government, no matter how, even if we are certain amount of us are low interest, even if the several parts in the society have low interest or low power, we should actually also play our part from the government to the medical students. Thank you.
Thank you so much, Andrew, for this presentation. It was quite very good, excellent. I like the parts where you brought out the analysis also. I don't know how that is so relevant to in the presentation, but it's actually very good. So thank you for that presentation. It was very nice. So I don't know if Victor has a comment on this. Okay, I think he doesn't have any comments. So I think the next, okay, I think he doesn't have any comments. I think the next group can just go ahead to the presentation. So SCOPI 08, I don't know if you are here, if you are still here.
Yes, we are.
Okay, please mute your mic. Okay, I'll make you the co-host now so that you can share your screen and start. So immediately he starts, his group members should sign the attendance.
Good afternoon, everyone. I'm Stephen Adewale, Group Leader for SCOPI Group 8, and presenting with me today is Olumo Aisha Oluwakemi. All right, diving into it, our outline contains the introduction, who are the key stakeholders, why we need intervention of the key stakeholders, the roles of the key stakeholders, and the conclusion. All right, so the topic is non-communicable diseases here, and they are a group of chronic diseases with high levels of mortality. They are of public health importance as about 41 million individuals are affected each year, and that accounts for 70% of global deaths. Each of these deaths occurs mostly amongst people of age 30 to 69 years. NCDs are common amongst the high income countries, but we have increasing numbers in middle and low income countries, with Africa taking the most hit. That means it applies to us. The most common forms of NCDs are cardiovascular diseases, cancers, respiratory diseases, and diabetes. They occur as a result of the combination of genetic, environmental, behavioral, and physiological factors. So, who are the key stakeholders we're reaching out to? The Nigerian Medical Students Association recognizes the impact of NCDs on our public health. Hence, we are making the call to action to the key recognizable stakeholders, and they are the government, the non-governmental organizations, the private sector companies, the hospitals, the universities, the medical students, and the populace. That covers virtually everyone. Now, why do we need intervention of the key stakeholders? The government, because the NCDs, which are public health issues, are a responsibility of the government to manage the affairs of the citizens, and the government does have the required resources to implement such an intervention as is needed. While reaching out to NGOs, the government most time requires the support of NGOs to accomplish aims such as this. It will also give the NGOs more leverage to partner with international bodies and individuals to address other public issues of importance. How about the private sector? The private sector organizations also lose their employees to NCDs, which leads to both reduction in manpower and financial capacities. The hospitals, the clinical and research skills needed to fight against NCDs are available within the hospitals. Also, reduction of the cases of NCDs aids hospitals to divert resources towards fighting other impending health issues. And finally, universities, due to the large population of students in universities, they have access to a wide audience and then can implement such things. Over to you, Kevin. Kemi. Hope everyone can hear me.
So what are the roles of the key stakeholders? The government needs to improve on the health budget to ensure that the public health facilities are properly funded, both at the primary, secondary, and tertiary level of healthcare. They need to also equip the health parastatals such as the NAFDAC, the NDLEA to fight against illegal substance abuse and distribution of substandard consumables. They also need to fund research institutes so that the government makes research-based policies and decisions in their fight against SCDs. The government, the non-government organization, they need to support the government by creating awareness and enlightenment on SCDs. They need to also provide youth empowerment and poverty alleviation schemes. They also need to support health agencies and other related law enforcement agencies against illegal drug abuse and distribution of substandard consumables. The hospital needs to enlighten their patients on ways to keep an healthy life. They also need to manage the public health funds appropriately and ensure that the NCDs are detected early and they are given the best form of care. The university needs to review the school curriculum to include sensitization on NCDs and other related diseases. They also need to ensure that the students in campuses and around their schools premises abide by the public laws. The medical student needs to enlighten their friends and families on NCDs, the risk factors, and their preventions. They also need to organize activities actively. They need to participate actively in outreaches. Then to the populace needs to ensure healthy living, avoid illegal use of drugs and distribution of substandard consumables. They need to avoid the use of traditional concoctions, bleeding creams, and soap because those are part of the risk factors that are identified in NCDs. They also need to do regular medical checkup. So in conclusion, NCDs are public health issues of great importance that are affecting a substantial number of our population. The cardiovascular diseases, cancers, diabetes, and respiratory disease are the most common ones. Then the commonest risk factors identified are cardiovascular risk factors, alcohol consumption, smoking, and physical inactivity. And all stakeholders have a role to play in the fight against NCDs. Thank you.
Okay, thank you so much for the presentation. So my few comment on this is concerning the presentation format. You were like you were reading it, if you get my point. And it will be more preferable in a situation when you are giving a presentation that you are giving bullet points and you are explaining it. It moves more smooth that way, and it's like shows the person you are presenting to that you really understand what you are trying to say, trying to point out. You get my point. So it's more better you do it that way. But everything, the overall, it was quite nice and very impressive. Thank you so much. So I think we'll move to the next group, right? So SCOPI 05, I don't know if they are still here. SCOPI 05, are you here? Please indicate. We don't want to be wasting time.
Yes,
please.
yes.
Okay, I'll make
my screen.
okay, I'll make you the co-host now so that you can share your screen. Please, immediately she starts, their group members should start to sign in. Immediately she starts, they should sign in. And know that you only have 5 minutes. I don't know. You just stop sharing your screen. We can no longer see your screen. As she's presenting scope, O4 should get ready, please. Please, Zita, can you hear
Can my
me,
screen be
please?
seen? Can my screen be seen?
It can no longer be
Sorry,
seen
I had
again.
network issues. I think I was cut off. Can my screen be seen now?
I didn't give you access. I just gave you access now. You can share it
Yes,
now.
my network connection was cut off, so I had to rejoin.
Okay.
Can my screen be seen now, please?
Yes, we can see your screen. You have 5 minutes.
Thank you. Okay. Good day, everyone. I'm Zita Chidera Ezeno, and I'm representing SCOPI 05. I'll be making a pitch for a policy document on strike in medical schools. Medical schools are educational institutions that offer a complete program involved with the training and certification of future health professionals for the betterment of humanity and well-being of all of its communities and people. In Nigeria, typical medical training lasts for 6 to 7 years. And we know that we have a number of unions, such as Academic Staff Union of Universities, ASU, the NASU, and then some in the health sector, such as the Medical and Dental Consultants Association of Nigeria, the MCAN, the Joint Health Sector Unions, the JOHESU, and then the National Association of Resident Doctors, NAD. Unfortunately, at times, these unions, they suffer neglect and their demands are not heeded to by relevant bodies. And this causes some of them to resort to strike actions to press on their demands after other more amicable means of settlement have failed. Strikes are defined as the collective withholding of labor or services by category of professionals to extract concessions or benefits, typically for the economic benefits of the strikers. Sadly, they've been on a high rise lately, especially in our public universities, and in most cases are caused by factors like the conflict of interest relating to wages and working conditions. Most of these strike actions affect medical schools, especially those involving the educational and health sectors. In a survey conducted in 2021 by Humango Media, a renowned media platform at Abuja, 85.2% of 115 medical students said they will move abroad to practice because of the numerous issues that beguile the medical practice in Nigeria. The most popular reasons comprise the countless strike actions, poor compensation of services offered, and the miserable treatment of practicing doctors. The alarming rate of medical students leaving the country and those tending to follow suit, coupled with the drastic effects of perpetual strikes on medical students, such as the extension of time for their medical training, disruption in the academic curriculum, the emotional, psychological, and financial strain, the rush situations that we see that take place when these strikes are eventually called off are worrisome. Strike actions actually come with positive and negative effects without bias, but then the attendant negative effects outweigh the positive ones. And that is why we strongly call on relevant stakeholders to take necessary steps to forestall future occurrences of strikes in medical schools. Our stakeholders include governments, ministries of education and ministries of health, our university and medical unions like the NUC, the ASU, JOHESU, MDCAN, NAD, medical schools, MSAs, and medical students. Because as we stated in our policy documents, an intersectoral approach involving combined efforts is needed to curb this issue. Now let us fix this bug. William Alger once said, after every storm, the sun will smile. For every problem, there is a solution. To this effect, my team recommends some solutions to combat issues of strikes in medical schools, namely, but not limited to, the government properly funding education and health institutions in the country, implementing policies that place the health sector, its workforce, and its training institutions as top priority, fulfilling agreements made with various unions in the country, ensuring standard working conditions exist for health workers and university staff, The university unions restructuring medical training in a way that exempts medical students from strikes due to the nature of their training. MSAs and medical students organizing campaigns against strikes whilst highlighting the various negative effects on medical students through the use of social media and other available platforms. University and medical unions should also consider the population, the people at risk, and the huge effects of strikes on the country when deciding to resort to strike actions. Alone, we can do so little. Together, we can do so much. Hence, we strongly advocate all relevant stakeholders to get involved, establish appropriate collaborations, and take necessary action. Thank you.
Thank you so much for that presentation. This was very excellent. Thank you so much for that. It was very, very good. And the slides look fine also.
Thank you. Thank you, sir.
You're welcome. So I think we'll be moving to the next person, next group. So it's SCOPI, I think so. I don't know if they are here.
SCOPI.
Okay. I'll make you the co-host now so that I can share your screen. You have 5 minutes to present, please.
Thank you. Please, can you see my screen?
We can't see your screen. And as he's presenting, and I think I saw, is it Aisha Dambata? Yeah, that scope 01 should get ready, please. As he's presenting.
Can you see my screen now?
I can't see your screen.
What? Come on. Sorry, I'm coming. Yes. How about now?
So I can literally not see anything, like nothing.
Wow.
We gave them 2 bread in the morning. That's all.
Sorry, please. Sorry. Can you see it now?
Yeah, we can see it now.
Okay, thank you. Good afternoon, everyone. My name is Victor Joshua, and I'll be representing SCOPI 04, and I'll be talking about medical education curriculum in Nigeria. So first of all, the outline is we're going to be discussing the definition, the history, the need for the change, the issues associated with the current curriculum, the stakeholders, their roles, and then we'll conclude. So introduction, I'll start by defining medical curriculum. This is a curriculum that involves the subject challenges and training to prepare a full licensed medical physician. From the definition that has been said, it can be seen that the quality of medical doctors or medical practitioners produced by an institution or a country is heavily dependent on the curriculum that is being used by such institutions. And it is safe to say that medical curriculum is like the bloodline of medical care and healthcare of a nation. In Nigeria, medical education started in 1948 before we got our independence and became an independent state. So it was heavily influenced by the British curriculum, as it started in UHC, which is the University College Hospital in Ibadan, as a branch of the University of London in 1948. So it evolved into 4 different generations of medical colleges with little modifications to the curriculum that was initially used in UCH 1948. So why do we need a change? As Albert Einstein said, we cannot solve our problems with the same thinking we used when we created them. In summary, what all this is saying is that there is need for a change. You can't use yesterday's methods to solve tomorrow's problems, not even talk about today's one. And the world is changing. Currently, we are still battling with the issue of COVID-19 that has that has touched everybody and has changed the way medicine is being, health is being administered to people. And then the impact of technology, the rise of outbreaks of many other pandemics and epidemics, the change of lifestyle and way of life of people, the coming of the internet, the information age, basically. So with all these things coming into play, there is a whole new world present, and we can't continue producing doctors using the same method we used in producing doctors even before our independence. So, as earlier stated, the world has changed, but the method in which we produce our doctors has not really changed. The world has changed rapidly. And due to these changes, our current curriculum has been facing certain issues with our medical doctors having inadequate exposure to research, poor assessment style. We use the objective structured clinical examination style, OSCH, which was invented in 1975 in assessing our doctors. And this has done a very good job in evaluating the cognitive and psychomotor domains of our medical students, but has failed in the aspect of our ethical reasonings and communication skills, which is very important in a medical doctor presently. The lack of usage of technology in medical education, poor attention to the mental health of students, and the cumbersome workload for teachers and students, with the issue of insecurity, financial issues, and the labor actions done by various labor groups, there has been irregularities with the academic calendar of medical colleges. So, truth is, everybody is a stakeholder in when it comes to the medical education curriculum, but we've chosen just three for the purpose of this presentation, and those three are the Minister of Education, the Vice Chancellors of universities, and the Provost of medical colleges. And the reason why these three were chosen is because of the high interest and high power that they have to bring about solutions to issues associated with the current curriculum and cause a reformation to the curriculum. How can these stakeholders be part of the solution? The Minister of Education can organize a committee of researchers and professionals that will examine Nigerian and international curricula, look for lapses, and update our curriculum. Since it has been stated earlier that our doctors are far behind, the creation of a task force that is in partnership with other regulatory bodies to create a standardized system of medical schools, curriculum, and teaching techniques and practices with proper monitoring and evaluation system will be very good. For the provost of medical colleges, they can increase the use of simulations, virtual learning, and training of students on telemedicine, as that's where the world is headed. Incorporation of proper research trainings into medical education from the primary stage till the clinical stage. And this is going to help the issue of research, reduce or abolish the use of standardized tests as they do not increase medical student decision-making skills and other soft skills. To the vice chancellors, can checkmate the participation of students in clinical activities, reach agreements with governments to avoid the incessant labor actions that disrupt academic calendars of the medical degree program in Nigeria, create intercalated medical programs which combine medical training with management and other fields. This enables graduates to have dual degrees such as MD, PhD, MD, and MBA at the same time, as done by even the colonial masters that brought about this whole medical curriculum in the first place. So
Thank you so much for the presentation. I think your time is up now. So, concerning the presentation, the major issue I had. Everything was moved so well. But as I stated earlier, your presentation should carry bullet points. Should not be too they should not be too much like written all over everywhere. And that will cause you to start reading. Like you won't focus on explaining, you focus more on please mute your mic. You focus more. You should try and avoid that next time. But overall, it's very nice. So thank you very much. So I think we'll be moving to the next group. I don't know if they are ready. The next group is SCOP 01. That's Aisha Dambata.
Hello, good afternoon. I'm here.
Okay, I'll be making you the co-host now. Please immediately she starts, the members of our group can sign in. Then as she continues, and score 02, that's Daniel Obiwolu, should get ready. The attendance is just for signing in. After you sign in, that's all. You can go ahead.
Can you see my screen?
Yes, we can see your screen.
All right. Thank you very much. Good afternoon, everybody. My name is Ambata Aisha Sani, the representative for SCOPI 01, presenting the topic brain drain in the Nigerian healthcare system. Today, I will be taking you over the definition, problems, and the potential solutions. First of all, what is brain drain? Brain drain is simply the migration of our skilled workforce to more favorable geographical, economic, and professional environments, and that is currently what we are witnessing today in Nigeria. So what is the problem? According to multiple researches that have been carried out in Nigeria, it is clear to anybody who has eyes that the number of skilled medical personnel in the Nigerian healthcare system are currently migrating and leaving the country in large numbers and in droves. This in turn is making us fall short of the minimum need set by the World Health Organization, and it is helping us to rapidly lose our human resources, which we need for our socio-economic development and the general growth of the Nigerian healthcare system. So who are our stakeholders? Our stakeholders here are the government, the Ministry of Health, the medical associations and student associations, including the Nigerian Medical Students Association, NiMSA. Why should our key stakeholders intervene? It's pretty simple. Nigeria is presently operating on a 1 to 5,000 ratio of medical doctors, as opposed to the figure that has been benchmarked by the World Health Organization. As opposed to the numbers that is benchmarked by the World Health Organization. And it is a sure fact that this number is sure to witness a substantial deterioration if the problem is not brought to a head and if our stakeholders do not intervene. This impact will be felt most definitely by the common masses who depend on the Nigerian healthcare system for their health security and their health needs. How can the problem be fixed? Well, for the problem to be fixed, and to conclusively put an end to brain drain in the Nigerian healthcare system, all parties and stakeholders involved will need to take a holistic look at the causes and take proactive measures to solve this problem. And these measures include reviewing of health hazard allowances of the health workers by the Ministry of Health and ensuring that the government enforces it. This also includes looking into the salaries of healthcare workers in Nigeria and seeing to the fact that it is increased in adequate measure to compensate for the deteriorating economic environments that we're currently facing in Nigeria today. Our stakeholders also need to do their best to create a conducive workforce and working environment for the workforce of the Nigerian healthcare professionals. And this should be made a compulsory fact, as if the doctors and other medical professionals are not happy with the work that they're doing, then they are sure to look for greener pastures and look for alternatives in different places. More solutions that stakeholders can use in tackling the problem include encouraging harmonious working relationships and environments among the medical teams by medical associations, and trying to increase the participation of medical personnel in policy activities, while also advocating or calling the students in questions, especially members of Nigerian medical students, to try to look forward to their roles as future members of the Nigerian healthcare system, and to encourage more participation in the activities of the Nigerian healthcare system. So with this presentation, we're effectively trying to explain to you why our stakeholders should take part in the activities of reducing drastically the ongoing brain drain in the Nigerian healthcare system and how they can fix it. This is not to say that these are the only solutions or these are the only ways that the problem can be tackled, but just a basic tip of the iceberg, and more discussion and more conclusions should be drawn succinctly from the topic. Thank you very much for listening, and we're open for questions.
Okay, thank you so much for this presentation. I would like to commend the confidence in the voice, how you stated it, like you were very, very confident. That's also very good when you're presenting. And also, you were able to work well concerning the, giving bullet points. But I would say in between, it's not so please, if you are joining in, please mute your mic. And it isn't totally, but some points were like a lot of writing and a little bit explanation. So, but you should also work on that. But overall, it's very good. So thank you very much. So I think we'll move on to the next group. The next group is SCOPI 02, right? That's Daniel Obiwolu. I don't know if she's here. Okay, I'll be making the co-host now. I've seen your hands raised so that you can start. I've made you the co-host, please.
Good afternoon, everyone. Please, can you hear me?
Yes, we can hear you.
All right. Mr. Joshua Aluga, Mr. Elikwachi Victor, Mr. Daniel Ebodagi, the supervisors. Good afternoon. Good afternoon to everyone. I am Oluwafumla Shukpade, and I'll be presenting for SCORE 02. All right, I'll be talking about a silent pandemic, antimicrobial resistance. An unconscious patient was admitted to the Lagos University Teaching Hospital, and his blood was taken to the lab to test for which antibiotics would actually fight the pathogen in his blood. And then all efforts proved abortive because all these pathogens have proved resistant to the antibiotics. Tell me, what do you think will happen to such a patient? It is either the patient dies or there is a higher cost of treatment for the patient. This happens every single day in Nigeria, where you hear that somebody was hospitalized and then after a series of surgeries and all, the person eventually dies. Antimicrobial resistance occurs when microorganisms adapt or they resist the suppressing strength of antimicrobials, thereby rendering the drugs ineffective. The World Health Organization has placed it among the top 10 global health threats facing humanity. And to shock you, AMR, which is antimicrobial resistance, is responsible for approximately 700,000 deaths in the world annually. And it is estimated to cause 10 million deaths by 2050. I assure you, you do not want a healthcare system like that, especially in a country of ours like Nigeria. The rise of AMR threatens curative medicine and various medical procedures, ranging from complicated surgeries to blood transfusion. That is the problem definition. So, why should the stakeholders intervene? Why should they intervene? Who are my stakeholders? The government, the World Health Organization, the healthcare institutions, the healthcare professionals. Why should these people intervene? AMR, antimicrobial resistance, has been established to be the 12th leading cause of death in Nigeria, with malaria and HIV behind it. I tell you, this is a silent pandemic that we need to fight immediately. AMR is a threat, especially to Nigeria's health sector, as it is already mounting pressure on the country's vulnerable health system. It poses a threat to the universal health coverage, the food animal industry, the SDGs goals, and the economy of the health. So, how should my stakeholders intervene? The proposed solutions. The government should create a framework to allow for intersectoral collaboration to raise awareness of AMR. They should effectively implement the national action plans developed in 2017. What's the national action plan? I'll mention like three goals of the national action plan, which is building evidence and raising awareness against AMR, applying the One Health approach, and investing in quality drugs while incentivizing the old ones. We should altogether create awareness. The Ministry of Health should monitor the adherence of healthcare professionals and workforce to regulatory frameworks that promote the prescription of antimicrobials. What I'm actually saying is that too much of antibiotics administered to a patient actually increases the resistance of a pathogen to the antibiotics. So the prescription should be minimized so that it can work effectively. Healthcare facilities, institutions, and universities. Healthcare facilities should ensure to adhere to government guidelines regarding the use of antimicrobials. The healthcare workforce and health professionals should work together as one to ensure that their workplace policies are fair and compliant with the AMR-related policies. And they should make sure to educate their patients on the dangers of misuse of antimicrobial drugs. Also, the agriculture and livestock sector, the pharmaceutical companies, they have a role to play. With this cycle shown on the screen here, please focus. Let's start from the development of rapid diagnostic tests, then to the elimination of growth-promoting antibiotics from animal food, then multinational collaboration and research sharing, research and development of new therapeutics, implementation of antimicrobial stewardship, and expanded surveillance for antibiotic resistance. I assure you that I do not want to experience a health system where drugs are ineffective. We want a good healthcare system in Nigeria. Thank you very much for listening.
Wow. This was very nice. Like, it was very, very nice. I'm very impressed. It was very confident and you explained it so well. This is so good. So that's very nice. Thank you so much for this presentation. It's really a great. This is so nice. Thank you so much. And also, I like the slides. It looks fine also. That's an addition. So thank you so much. So I think we'll move to the next group. So the next group is SCOPI. That's Okolocha Stephanie Mary. After her is SCO for Deborah Adebayo. I don't know if Okolocha is here.
Yes, I'm here, please. Good afternoon.
Okay, good afternoon. I'll make you the co-host now.
Right, thank you. Okay.
You can share your screen, and also immediately she starts, her group members should sign in.
Sorry, please.
Please, as she's sharing her screen, and Deborah Adebayo should get ready, and Oko Osinachi also should get ready.
Please, can you see my screen?
Not yet. I can't see your screen. Please, let's be fast about it.
Sorry, having an issue sharing it.
Okay, George, can you hear me?
Yes, I can hear you. I've been waiting for you since.
Yes. Let's have
Oh God.
Your voice is cracking. I can't hear you.
this to save time. Let's have the next person.
Okay, I get you.
Yeah.
So before you fix that, I think Deborah, if she's ready, Deborah, are you ready, please? Before she fix that issue.
I'm ready.
Deborah, your voice is cracking. Like I don't know what's wrong.
I'm ready.
Okay, please, you can share
Can
your
you hear
screen.
me?
Yes, I can hear you now.
Okay.
So those in Deborah's group should please sign in. Immediately she starts sharing her screen. Please sign in.
Can you see my screen?
Everywhere is just dark. I can't see us. I think you are sharing, but it's just dark. Like it's dark. I don't know what's wrong.
Okay, can you see my screen?
We can see your screen, but we can't see the slide. That's just the problem. It has even went off. Wow, I think we're still wasting time. So I think we just have to go back. I don't know if she have fixed the issue now.
I think I can try again.
Okay, then you can share your screen now. Just share it. We can't see it. Please, can you hear me? Click.
Is it the who are waiting for now? Is it Deborah or the first person?
It's the first person. Deborah is having some funny network issues. And please click share on your Zoom screen. Then you see screen. Just scroll down, you see screen. Then you share it. I don't know if you can hear me. Stephanie, can you hear me, please?
Yes, I can hear you. I did click on share, but it's not.
Just click on share and scroll down. You see screen. To show you some options, then you click screen.
Yes, I clicked on screen. That was what I did. And I am still in limbo.
Oh, I don't know what's wrong. Your group, just share the screen as you present.
In this group, who is the second person that is supposed to stand as a backup? If the person can also try his own, let the person present, please, so that we save time.
I seriously need to save time. Like seriously. I just hope that
Joshua, do you get me? Do you get that?
Yes, I hear you. I get you. Like I
Who is
seriously
supposed to stand in for her as the backup or something?
I think a member from your group should share the screen. Since you can't, like your phone is
Yes,
not
we
working.
asked two persons. If anybody can share the screen, then I believe they are present.
Yeah, someone help me share it, please. Sorry.
Who is the person, please? The person should indicate quickly.
Victor.
Is it Victor Yorum?
No, Diko.
Okay, Diko. The person should indicate. I don't know. Like the person should either raise his hands or just unmute. Okay, Oladipo.
Yes.
Oh, Ona. Oh my God, I'm coming. I made the wrong person. Please, is it Onadipe Almighty that I'm giving the access?
No, it's Oladipupo Akongbe.
Okay. Please, let's be fast. I'm seriously need to
Sorry.
save time. Please, you can share his screen. I don't know what he's still waiting for.
Okay. Please, can everyone see the screen now?
Yes, we can see it.
Okay, first of all, I'm so sorry for the delay. It was unforeseen. Good afternoon, everyone. My name is Okolocha Stephanie Mary, and I'll be presenting on behalf of SCOPI 03, and our policy document is Medical Education Curriculum. Outline, please. So we have the outline here where we'll be introducing and why it is important, who does it affect, the problems being faced, why our stakeholders should be interested, and what the stakeholders can do to effect change, and then our conclusion. Next, please. Abraham Flexner once said, medical education is not just a program for building knowledge and skills in its recipients. It is also an experience which creates attitudes and expectations. This should tell us a whole lot that the curriculum being used to train our health care practitioners is as important as the health practitioners themselves. It's not just about books, it's a lifelong commitment. It is a thing of service, and it is something that people should actually be passionate about. The current curriculum that we're using is over 70 years old and was first introduced during the pre-colonial era. So it is currently not up to date in the sense that things have moved faster, but we are still using that curriculum. Next, please. Now, why is the medical education curriculum important? It is important because it is a part of the training program of medical schools, which serves as a framework that sets expectations for the learning of medical students. The main purpose of any curriculum is for students to learn and learn effectively so that the quality of doctors that will be put out to the society and our system will be viable. Next, please. Who does this affect? Everyone. We say everyone here because in the long run, everyone has health, everyone has a body, everyone has a system, and the doctors being trained in schools are directly affected or directly affect this system. So we all need to be concerned about
the medical education curriculum so that we'll be able to put forth doctors who are truly interested and truly passionate about it. Because at the end of the day, sometimes you go through medical school and you come out without passion and you just want to make money, and you don't really care about the patients. The problems being faced, we have the lack of research experience, burnout and mental stress on the students. We have difficulty when trying to compete and fit in internationally, uncertainty in the number of school years, the archaic methods that are being used to teach, and even the grading system, such as negative marking. So you begin to become a whole lot stressed and scared most times. A lot of students face a lot of anxiety, and this is very bad. And you read a lot, and we do not have as much practicals as we should. So we tend to have very creative imaginations, and our curriculums are very, very bulky and with very short time to cover them. And then we don't really have standardized tests or examinations. Somebody can just come and set anything that he feels like setting. I don't think there's no really check up and balance methods that are being used for our exams and tests. Why should our stakeholders be interested, and why were they chosen? Some of the stakeholders we chose and we spoke about in our policy documents were the Provost Medical Students Association and medical students themselves, the Ministry of Education, the Medical and Dental Council of Nigeria, the National University Commission. All the stakeholders were chosen because they all possess power to effect change in medical education curriculum directly or indirectly, whether it is low power, high interest, or high interest, high power. They all have power in one way or the other to effect change in how the medical education curriculum in Nigeria is seen as of now. Next, please. What can the stakeholders do to effect change? Now, we can review and upgrade the medical education curriculum. We can change the archaic methods of teaching, exclude medical students from strike actions so that students will have time to finish the curriculum faster. Because currently now we are even on strike, and some of us have even forgotten what we learned in our previous classes. And then imagine going back, and then you still have a whole bulk of work to face. So this affects the quality of doctors that we release in the end. Then we need to create awareness on mental health. This can be done amongst the students, where we take care of ourselves, check up on each other, and make sure that.
Thank you so much for that presentation. Your time is up. Thank you so much. That was quite nice. Due to the fact that you had some of the glitches sharing your screen, technical issues and the rest, but it was quite nice. Thank you so much for this presentation. So I think we'll be moving to the next group. I think the next group is Deborah, right? I don't know if she's ready so that she can present.
I'm ready.
Okay, I'll make you the co-host now.
Okay.
Please, it's 5 minutes. Immediately she starts sharing her screen, those people in her group should sign in, please.
Can everyone see my screen?
Yes, we can see your
screen. Can everyone see my screen?
Yes, we can see it.
Okay. Good day. Okay, thank you. Is Deborah Adebayo, and I am the representative for SCOPI 4. The topic of our presentation today is drug addiction. We have our outline, which basically focuses on three segments: the problem, who can help, and how they can help us to solve the problem. Okay. What exactly is the problem? Drug addiction has become a growing problem in Nigeria. It started a long time ago, and it has been on the increase in recent times. It is a chronic disorder that is characterized by compulsive drug seeking and use despite detrimental effects. Addicts know that the use of drugs, the abuse of drugs, and addiction to drugs has negative effects on them, on their family, on the society, and even on the nation. But for reasons they cannot control, they just can't stop. Addiction has long been viewed as a moral shortcoming among people, but it is best for us to view it as a medical problem so that these people will be able to get access to help when they need it and without stigmatization. Drug addiction has far-reaching effects on individuals, on the community, and the country as a whole. According to the 2018 National Drug Use Survey, that's like research that was carried out to find out how people use drugs and in what amounts and if they use it properly or they abuse it. This took place in 2018. There were about 14.3 million drug users nationally in our nation, and about 3 million of them suffered from addiction. This number projects addiction not just to illegal drugs, but also to legal drugs as well. So what class of people are most affected by drug addiction? Studies have shown that the occurrence of drug addiction in Nigeria is more prevalent among the younger part of the population. They include youths like you and me, and then among people with a low level of education and a low income. So if most people that become addicts tend to have a low level of education and low income, why do they get addicted? There are a lot of factors that can put a person at risk of developing a drug addiction. These include, but are not limited to, a family history of addiction. A person who comes from a family where the father or the mother or one of the distant relatives is an addict has a tendency to develop an addiction. An unsafe environment where there is easy access to drugs can also help develop an addiction. Mental disorders and emotional problems push people to use drugs in ways that they would otherwise not use them, and this is what forms our problem. So who can help us? Drug addiction is a problem that should be approached decisively. Everyone is a stakeholder in fighting against drug addiction, but we picked out our key stakeholders, and they are the government, religious bodies, youth and community leaders, medical schools, secondary schools, and other institutions. These stakeholders are full of interest and power, even though they should have high interest towards the subject of that affects us indirectly. In a bid to find a solution to the current problem of drug addiction in Nigeria, we call on, one, the government to invest resources in research and mass education. Investing resources in research and mass education would help to enlighten the public on the problems we face with drug addiction. Ensuring availability and access to treatment facilities and rehabilitation. Formulating and implementing laws prohibiting the sale and purchase of illegal drugs, and they are to strengthen cooperation amongst all stakeholders involved. Okay, we also call on the religious community and traditional leaders to lead by example, by abstaining from drug addiction so that their followers would walk in that path as well, encouraging others to do the same, serving as a source of enlightenment to their followers on the effects of addiction, reporting illegal drug sources, and supporting other bodies involved in preventing addiction. Schools and institutions are also called upon to provide holistic education on addiction, to incorporate addiction into the curriculum, provide access to information on the subject, and help students already suffering from addiction. We've noted that the greater percentage of people suffering from addiction are young people. Most of them are still in school. So schools can help by providing rehabilitation for students already suffering. Okay, in conclusion, we found out that curtailing drug addiction requires the cooperation of everyone involved. And that means each of us has a role to play, whether as a major or minor stakeholder. I have a role to play, you have a role to play. And if we all work together, we'll be able to curb the menace of drug addiction. Thank you very much for your time.
Thank you so much. It's very, very good and very, very impressive. It's very nice. So, I don't know if Victor has any comment. I don't even know whether he's still here. So, to save time, we'll be moving to the next group. The next group is Osinachi Maureen. That's the next person.
I'll be the one taking the presentation for my group.
Okay then. Let me
Score 808.
Okay, I've made you the co-host now. You can start. So immediately she starts, the people in her group should sign in the attendance.
Sorry,
You can
I'm looking for where the screen share is.
just check your Zoom app. You see share in the middle. Just click share. Just click share. Then you scroll down. You see screen.
Okay. Let me tell Emmanuel to share the screen instead, please, because I'm not seeing it.
Okay, I don't know where Emmanuel is. Emmanuel, if you are here, just raise up your hands so that you can share it. Just indicate. Please, let's be fast about it.
Sorry, Josh, how many more groups do we have?
I think we are left with, is it 1 or 2 groups? Please, if you have not present and you're supposed to present by this time, please put your name in the chat box. Put your name in the chat box, please.
Oh, don't worry. No.
Yeah, and I think Daniel is here. Please, Daniel, take note of those in the attendance, those writing their groups now that will be presenting, because I'll be leaving this meeting like any moment. After this group, I'll be leaving. Daniel, can you hear me?
Sorry, can you guys see my screen?
Yes, we can see your screen.
Okay. Okay. Is everyone ready?
Yes, we are ready. You can start.
Okay. So, good evening, everyone. I'm Tilegiado Ewesi. I'm taking the presentation for food safety for score 808. So, as an introduction, I just want to define what food safety is. It's basically the processes that are used to detect and remove and control risks involving your food from harvest, that is from planting to harvesting to final consumption by your consumer. Food safety is under a very big umbrella, which is food security. And food security, that umbrella, is just anything that an organization or the government can do to ensure that everyone, every is underlined, gets access to safe and nutritious food, irrespective of their socioeconomic level or their gender. This umbrella also includes the AMR that we spoke about before. So foodborne diseases are on an increase, majorly because of the environmental factors and like temperature and everything. So things that were previously having low risks, such as dry foods like cereals, are getting exposed or are getting, they are getting exposed and then giving more citizens infections. So what is the main problem? The main problem is that these foodborne diseases, in as much as they are affecting individuals, that's giving you cholera, they're giving you dysentery, diarrhea, they're also affecting communities and the country as whole. Why? Because one person taking time off their work equals loss of funds. This loss of funds accumulates and gives the government the lower tax income, and then it trickles down, low tax income and everything else. Who are our stakeholders? Basically, our stakeholders, we are going to group them into 4. Firstly, is the high power and high interest stakeholder. This is the federal government acting through ministries like the Ministry of Health. And who are our stakeholders and what can they do? So the federal government acting through the Ministry of Health, through NAFDAC, can form policies, put in policies and rules and sanctions that need to be followed exactly and implemented vigorously through other members. Next off, we're going to ignore the high power, low interest, because at this point we're just going to follow them up and see what they can do, because the Ministry of Environment and then the Ministry of Trade and Investments are not concerned with food in particular. Low power, low interest, a stakeholder in low power, low interest is the food industry. yes, they are involved in food, but they don't have any power to implement any policy. And then they have no interest because buying high quality foods is going to affect their budgets and then thus reduce the profits that they will make. Then lastly, the low power and high interest. These are the citizens. These are the everyday normal citizens. Yes, everyone wants to eat good food prepared with good ingredients, but we don't have the power to implement that. And then with the times that we are in, with this bad the dollar exchange rate and then the increased cost of living, people are relying more on, I don't know how to, there's a word for it in my language, but it is those moldy millets and moldy tomatoes because that is what they can afford to eat. And this exposes them to even more things than people that are buying fresh fruits from the farms. People in other places as well, like Lagos, are depending on people up north and in the north central regions to send food to them. And then with the high insecurity levels, people are getting kidnapped left and right. They cannot get this food when they are meant to get it. And even when they get it, they might be spoiled. Sorry. So how can we fix this problem? We're going to start from the beginning, the federal government. Everything goes back to the federal government. If the federal government implements good security measures, food will be delivered where it's meant to be delivered. If agencies such as NAFDAC implement those policies strictly, then the tampering of best buy dates that people have, the selling of foodstuffs that are expired or are spoiled is going to be curtailed. This also goes to drugs and every other thing. Involvement of other disciplines. We are not an island. The medical field, it involves so many other people. Veterinary medicine needs to be, veterinary medicine needs to be involved. The pharmacists, the food nutritionists, everybody needs to stand up and fight this head on because food safety does not know any level. You don't know what you are eating in the big restaurants that you are going to. It can affect you at any single time. And Nigeria, you just need one moment for Nigeria to affect you, and then it's game over. One moment for you to get Lassa fever, it's game over. Even when you are protected in the hospitals or you think you are protected in the hospitals, you can get, or you are not doing infectious diseases in the hospitals, you can still get exposed to these toxins. Because I think last year, December, there was an ONG doctor that died in Nasarawa from Lassa fever exposure from a pregnant woman. He did not know that she would have Lassa fever. He was not an infectious disease scientist, infectious disease doctor specialist. This is why we need to tackle food safety immediately and fast, because everyone can be affected by food safety. Okay, that is all. Thank you very much. If there's anything more to talk.
Thank you so much for this presentation. I think Daniel is here. Daniel, please, do you have any comment on this presentation, please, before we move on? Let's be fast.
All right, good evening. Sorry,
good afternoon.
All right, the presentation is quite okay. Your slides, I think, they're going next time, apparently, but subsequently, you need to work more on the arrangement of a slide, but the arrangement was quite okay. Your presentation strength was, confidence was quite all right, although you had breaks in between. I think that could be worked on more, but overall, you did very well.
Okay, thank you very much.
Okay, thank you so much. So, I don't know. Okay. So, those that will be presenting, I've taken note of their groups. I'm sharing it now. SCORI 03, SCORI 06, SCOPI 09, and SCORI 08. I think they indicated that they are quite ready for this presentation. So, I don't know if there are other ones that I've missed or there are ones that I've not missed. And please, Daniel, if you can see it in the chat box, I've written down those that are remaining. So I think you can move on from here because I'll be leaving the meeting in the next 2 minutes.
All right, moving on. Thank you very much, Joshua, so far. Okay, moving on to the next presenters. I don't know if Score 03, if they are ready now. Sopre, you can just signify so I can make you a host. Okay, righteousness. Okay, all right. Sopre, I'll make you the host now. So you just share your slide and then we start. All right, you can share your screen now. So bring and move ahead. Okay. Okay, please, you have 5 minutes.
Okay, can you see my screen?
Yes.
Hello?
Can see your screen.
Good afternoon. I'm Minafru Supreme. I'm representing SCOR 03. I'm talking about drug addiction. Drug addiction is the progressive and
sorry for interrupting. Please, the group members, please just sign in your names.
Okay.
Presenting.
Okay. Drug addiction is the progressive and chronic disorder that leads to an irresistible urge to use legal and illegal drugs despite the significant negative impact. What is the problem of drug abuse? Drug addiction causes problem of insecurity, banditry, robbery, lawlessness, and is also responsible for most family conflicts, resulting in mental, physical, and psychological abuse. It is responsible for the loss of employment, poverty, unhappiness, and a plethora of serious health conditions. Who is my key stakeholder? My key stakeholder is the government. And why should my key stakeholder intervene? It will aid in curbing the ravaging insecurity and lawlessness in the country. In Nigeria today, banditry and lawlessness are the order of the day in Nigeria. So if drug addiction is curbed, banditry, insecurity, they will be curbed, will be nipped in the bud, because as we know, drug addiction is the fuel of insecurity. So if the government will intervene in aiding drug addiction, in stopping drug addiction, there will be security in the country. And number two, why should my key stakeholder intervene? It will put an end to so many conflicts today. Like, for example, somebody high on drugs enters a vehicle, moves and rams another person. From just that incident, we'll have health hospital bills, we have police arrests, we have court cases, we have trauma resulting from that. So if the government can help in stopping drug addiction, all these societal conflicts will be on the low. And crime, why should government have in the third point? Crime rate will be on the low. As we know, I said earlier, drug addiction is the fuel of crimes, of insecurity. When there is no drug for these criminals to take to perform their acts, crime will be on the low or minimal rate, because they have nothing that is motivating them to go forward. And lastly, why should government intervene? The snowballing of lung and liver cases stemming from drug addiction will be greatly reduced. In today's hospitals now, there are so many health challenges poised from drug addiction that will be totally nipped in the bud if government intervenes and stops drug addiction. And how can they fix the problem? Number one, by sensitization of the media. If they talk about the adverse effects of drug addiction, people will know better, because what is really affecting us in Nigeria is the ignorance on drug addiction. Most people don't know that what they are doing is bad, but when they are sensitized, they will be able to know that there is better. They will be able to stop drug addiction, and they won't be indoctrinated into drug addiction. And secondly, by creating, revamping, and implementing effective bylaws. Most of the laws we have today, they are old, they are outdated. If we can revamp them, making them new, and implement them, that is a major problem we face in Nigeria today. It's not because the laws are not there, because of the lack of political will to implement them. That's why most of the laws look useless. If the government can help, this is very important, in implementing them, they can help fix the problem. And the third point, by recruiting and adequate training of NDLA personnel. Another huge problem facing the NLA is they are grossly understaffed and they are not adequately trained, because sometimes they go to these drug cartels, they are about just 10, and the cartels overpower them because they are more in number. So they need to recruit them more and train them more. And my and the fourth point, how can they fix the problem? By inculcating into the curricula of all levels of education, from the primary, secondary, and tertiary, on the effects of drug addiction. If a primary school boy knows the effects of drug addiction, even on the secondary level and the tertiary institution, it will be very hard to convince him or to trick him that drug addiction is good. He will know that drug addiction is bad. And how can government fix the problem again? By subsidizing the rates of accessing rehabilitation centers in the country. There are few rehabilitation centers, but the problem facing them is that they are very expensive. People who need those rehabilitation centers, once they see the prices, the price of accessing those facilities, they turn back, they run away. So if government can help in subsidizing these rehabilitations, the fees in accessing the rehabilitation centers, it will go a long way. And how can government fix the problem? By funding and initiating synergy between drug and law enforcement agencies. Another problem facing NDLA, they lack funding, they lack synergy between the sister agencies. And how can government fix the problem again? By tightening our borders to reduce the influx of drugs entering the country. A major problem facing us now. Our borders, that's a big pathway of drugs using to enter the country. If the government can tighten our borders, that will go a very long way in fixing the problem. And last but not least, by funding and encouraging medical institutions, medical students associations to host seminars and outreaches, educating the public about the adverse effects of drug addiction. If we are encouraged as medical students to host seminars about drug addiction, it will go a long way. So this will show us that every one of us has a role to play in ending drug addiction. Thank you.
All right, thank you very much, Superior 03. All right, for that presentation. First, I think for subsequent presentation, you try and be as relaxed as possible. One, then also you had just 2 slides, which is not very good. Even though probably you didn't have much to talk about, let's assume you could actually find a way to actually make the slide to be at least 10. And also you can put a lot of pictures so it can be more engaging. You understand? But I think quite okay. Your confidence level was nice. Your delivery was fair. So anyway, well done. Okay, moving on to the next group. I don't know if Victor have anything to add to this. Director.
Yes. Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
Can you hear me? Chief Daniel. All right.
Yeah, we can hear you.
Well done. All right. Thank you. Well done, Chief.
Okay, I think he's having technical glitches.
Geo agents. I didn't see you listed your stakeholders from just like the previous presenter did, from high interest, low power, and high power, low interest, and all of that. If you had listed, let's see your stakeholders. So that we know that your presentation covers every stakeholder, not just focusing on the government, and then you had just one point on medical students. Your majority of your points just hit were mostly straight we're straight to government, NDLEA. What if the person you met in this program or in this conference was not pitch your how will you pitch your message to him? You understand? So it's very important that in presenting, we try to cover everyone because this is a general presentation we are giving, not specific. We didn't specify who you will be meeting. So we presentation every stakeholder. You understand? That's basically it for me. Thank you very much.
Thank you very much, Victor. Okay, sorry. Moving on to the next group. That's choreosis. I don't know. Okay, Malik. Okay, you have raised up your hand since. All right. We just make you co-host so that you can share your screen and your group members. So please sign in now. The link is in the chat box. So you have 5 minutes. Please, the next presenter should please get ready. Just indicate so that immediately it's done, I can just make you the host without wasting much time. So SCOPI 09, I'm referring to you. Please just signify so that immediately Malik is done. I'll make you a co-host so that I can share your screen and then present. Malik, I don't know, I can't see any movement as regards sharing a screen. Are you having technical difficulty?
No, I'm still looking for the slide. Sorry.
Okay. Would have really appreciated it if you have done that before.
I wasn't the admin.
Okay, I'll give you 1 more minute to do that. And if not, I'm going to call the next SCOPI 09, person of Chineyere. So please get your slide ready also. Pending the next 1 minute if Malik is able to come through.
If a member can help me share the screen, I can't find.
All right. I think Malik, just try and work you around that. Let me just so SCOPI, if you are ready, let me make you co-host.
I'm ready now.
All right. Please, you have 5 minutes.
Right.
We can't see your screen anyway.
Yeah, you should see it now. Can you see the screen now?
No.
Sorry, can you make me do so I can share for Malik?
Okay, please just raise up your hand. Let me. Are you innocent?
Yes.
All right. Okay. Now go ahead, please, and help him out. I mean, your time is going. I think we have 4 minutes now.
Right. I can't see the screen yet. I still can't see the screen.
Innocent, I thought you trying to help out with technical difficulties. So I think you can see your screen now.
Yes, I can see it now. All right, thank you. Good afternoon, everyone. Standing on the existing protocol, I am Adi Ahmad Malik from SCORI 06. I'll be presenting on the mental health. So these are the outlines. Next slide, please. Next slide. All right, so as part of introduction, mental health is the single most important thing to woman alive. It is the reason we appreciate life and look forward to a productive life. So also, the mental health issue is a key component of health as defined by WHO. But in spite of that, there has been a significant lack of funding and inaccessibility to the health services nationwide. Mental health is fundamental to achieving universal health care, and access to these treatments is still limited by various instances like underdiagnosis, lack of awareness and research, etc. Next. So the challenges facing mental health care in Nigeria. So generally, there is low focus on mental health due to lack of observable things, core indicators, resulting in poor resource allocation and foreign investment. Health sector reformers also, they are discouraged by the seemingly complex nature of mental health because it's has subtle symptoms. High incidence of mental health problems is also in excess of the available health care, just as for generally all medical health problems. Lack of intersectoral collaboration such as education, resulting in lack of social development and social action in mental health. There is often incomplete intervention due to lack of resources, inadequate planning and logistics, etc. Next slide. So why do we need our stakeholders to intervene now? There is high misunderstanding rate regarding mental health and mental health care because many people experience mental illness, they experience it in secret and without achieving proper care. So we expect the stakeholders to intervene due to the importance of mental health. It is important to managing life's challenges, to maintaining physical health, etc. Next slide. So these are recommended solutions to our stakeholders. Our stakeholders include the federal government, NGOs, down to the medical student associations. We expect them to give more focus on mental health and especially the government to increase funding to mental health care, including awareness and research. There should be persistent and concerted efforts towards simplifying mental health and encouraging health sector reformers. There should be increase in political will from the government, public welfare, awareness, etc., in order to cut the high incidence of mental health problems. We expect more intersectoral collaboration, especially from sectors like education, so as to educate people and to give chance for social development and social action. Efforts should be made to offer complete interventions to those with mental health problems. In conclusion, mental health care is critical because it is important and similarly, it is due to the subtle nature of mental health problems. Please take care of your mental health. Thank you.
Interesting. Anyway, thank you for that. Victor, I don't know if you have anything to comment.
Anyway, I think let me just start by commending. Well done for the presentation. Just Daniel earlier said, I believe every participant present have been listening to the corrections that have been made. This is not just for now. We're giving these corrections for future purposes. The slides should contain pictures. They would help explain your points. You understand? Whatever you are explaining, if it's too wordy, it is too it's too much words and everything, people may not really follow what you're saying. But when you have pictures, illustrations, and schematics like that, we could see, and it will better portray or relay your points. You understand? And of course, with that now, that would help increase the number of slides and even help you in your explanation. Despite the time, you still meet up when you have pictures. Pictures help to relay your points directly. Then your stakeholders, it seems you didn't have a slide for it. I'm not sure. I'm part of your stakeholders. I'm not sure. Your slide is not telling me where I fall under. You understand? So if I'm representing the government, I can't. Okay, though you mentioned government, NGO, and medical students, I believe there are still some other bodies that can be covered. You cannot be speaking to. Let me still say maybe what do I use? presenting a slide with the officials there or something, they would, and when you are listing your stakeholders and you didn't list them, they would feel that they are not part of your projects or something. So they would pay less attention. So it's very important that you do proper stakeholders analysis and mapping so that you incorporate everybody in it. Thank you very much.
Thank you very much, Victor. I hope you are ready. Well, from my side, I'll be very blunt. The presentation was not very good. But anyway, the slide was poor also. So just try and work around it next time when you have such an opportunity. Please, Kupaona, you are next. I've made you co-host some minutes ago, so you can share your screen and start presenting.
Please, can everyone see my screen?
Yes, we can see your screen, but we can't see the slide. All right. Yes, we can. Please, group members to please sign in. You have 5 minutes. Your time starts now.
Please, can everyone see my screen now?
Yes, you can see your screen.
All right. Good evening, everyone. My name is Irizindu Chinonyarem, and I'm from SCOPI Group 9. I'll be presenting this evening on access to clean water, hygiene, and sanitation. During the course of this presentation, I may sometimes refer to clean water, sanitation, and hygiene collectively as WASH. All right. Access to safe water, hygiene, and sanitation facilities is essential to the health, well-being, and development of Nigerians, and indeed any country. It is so important that 12 years ago, it was recognized by the United Nations as a human right. In Nigeria, it is no news to any of us that there is gross inadequacy of access to safe water, sanitation, and hygiene. Like we see it all around us every time. We see it every day. You see it on the road with the empty dustbins. And in some states, like here in Enugu, where I stay, we do not have access to water. Most times we have to buy water in drums and in tanks. These are some of the problems facing Nigeria today as regards safe water, sanitation, and hygiene. This problem is mostly due to a deficiency in human capital, poor funding and investment, unfavorable regulatory environment here in Nigeria, also combined with other challenges. These are the major causes of inadequacy of access to safe wash in Nigeria. Our key stakeholders are international organizations and NGOs, the government, community leaders, healthcare organizations and facilities, and medical students associations. These are the groups of people, these are the organizations we believe have the power and the funds to actually do something about the wash situation of Nigeria. These stakeholders need to intervene because the lack of access to water and sanitation facilities is at the root of numerous issues we have in the country, such as diseases, malnutrition, poverty, and so many others. Poor sanitation hinders development while exacerbating health problems and poverty. About 70,000 children under 5 years old die annually in Nigeria because of waterborne diseases. We see this everywhere, cholera outbreaks and so many others. A lot of children actually die in this country because they do not have access to clean water, because they do not have access to hygiene facilities. If there is no intervention in the wash sector, the health of the population will eventually decline. And I cannot overemphasize on this. We've seen this over years, and if we don't intervene now, if the stakeholders do not intervene now, it will continue. And further down the line, the health sector of Nigeria is going to be worse than it actually is right now. Now, I'll talk about how these stakeholders can actually come in and fix this problem. That's the problem of inadequacy of access to safe water, sanitation, and hygiene. International organizations and NGOs should be engaged to help facilitate community consultation. They should also support youth-led organizations and other key actors by providing training, equipment, and investment to ensure creation and sustainability of WASH projects. These international organizations and NGOs actually have the capacity to organize trainings and let people know about the importance of WASH in their community, how it can help to prevent diseases, how it can help them to live a better and healthier life. And they can also provide the equipment necessary for these services. The government also have a role to play when it comes to fixing the WASH situation of Nigeria. The government should create and track specific budgets for sanitation and water, and to monitor and assess the impact of their spending. The government actually needs to create particular funds that are directed towards maintaining and creating WASH services in Nigeria. This is actually very, very necessary. If the government does not intervene, I don't know who else can intervene. The government actually needs to intervene in this. And they can also eliminate inequalities in access to services by population groups while ensuring WASH spending does not discriminate. In Nigeria, we see it a lot. Most rural communities actually do not have access to WASH. The urban communities are more favored when it comes to access to WASH. So the government should actually make sure that not just the urban communities get this access to safe WASH, but also the rural communities. Everyone needs access to WASH, irrespective of their social status, irrespective of their income, irrespective of where they live. The community leaders.
All right, thank you very much, Chinayere, the group leader of SCOPI 09. Your time is up. I was up, if I'm to say, but I was just waiting for you to try and round off the stakeholders, because that is one of the key parts of the presentation. But subsequently, please try and make sure you are able to drive home your point in a very stipulated time. Okay, over to Victor. I don't know if you have any comments as regards presentation. Please, the next group, get ready, just signify so that I can make you the group co-host. Score 08, please. Raise up your hand, I can make you the co-host so you get your slide ready for the next presentation. Thank you.
All right, beautiful presentation, SCOPI 09. Just like you said, you see, you're before your stakeholders, so it's very important you're able to drive home how they can engage in implementing the policy. That's a key part of your presentation. So less emphasis should be on, okay, yes, we have the problem. What is the problem? Why? Who your stakeholders are? And then why they should engage and how they can engage. See, particularly, you should be particular about how they can engage in it, because at the end of the day, this is what they will go. Now they know the problem, you know why you want them, but they don't know how, because you are not effective with your timing. So please ensure you do that. Thank you very much.
Thank you very much, Victor. Your presentation was nice, actually. Although you slide a lot of writings, so it was a bit clogged up. And then you were at the point reading through the slides, so it was a little bit disengaging. Overall, you did very well. Your confidence level was very high, and your presentation power was also very nice. I wish that you actually manage your time well, because I was actually expecting more from the stakeholders, because that's actually where the bread and butter of the presentation is. And I think I've worked in WASH enemy before, so I was waiting to see.
That is not really good. One you got school, first semester, second semester, third semester.
So I was actually waiting to see what you're going to talk about the stakeholder analysis, because I had a bit of practical in it. But anyway, sad story. Time was up. Subsequently, when it comes to presentation, always be on time, please, and keep to it. Thank you. Don't worry, your time might not affect your presentation score anyway, but you did well anyway. The next group, score 08. I don't know if you're here. I've asked you to signify earlier on. I'll give you 1 more minute to do that, and if not, I think we'll come to the end of today's presentation for this particular.
I believe that's the last group, right?
Yes, that's the last group.
Chief Daniel, I believe. All right.
My director, what did you say?
No, I was asking if score 08 would be the last group, if they are the last group.
Yes, sir, it's actually the last group. It's the last group.
All right. They are not present?
I don't know. Initially, they signified that they're around, but I don't know why they are not responding. Benefit of doubt of network issues and glitches. I'm going to give them 1 more minute. Once it is 4:01 and no response from them, we'll call it a day.
All right, then. That's fine.
Thank you, sir. Anyway, before the time elapses, let me just add on 2 things as regards presentation. When you are presenting to particularly stakeholders, actually, one very important part of this training that I was very much happy that was included was its presentation, because these are things, whatever you do now are things that will build you for a lot of subsequent presentations that you're going to do in the nearest future. And trust me, medical school, you do a lot of presentation. I think for those in clinical still will have already been having a fair dose of presentations. And when you get to housemanship, you do a lot, at least. I know you do at least 5 presentations when you're doing your house job. Then move over to probably your NYSC and stuff. You might not do much, but when you do your residency, just like you do a lot, like almost every 2 months or every 3 months, you do presentation. So actually, this is a very good massive foundation. I think some of us from our presentation, I think we already have a good background of it, and please just build on it. There are things that you could actually just work on and then build yourself. Irrespective, medical presentation is quite different when you are presenting to stakeholders. It's a bit different. If you're in clinical classes and you're putting the money reviews, you know it's a lot different from when you're presenting to stakeholders. Probably you have attended where they're pitching ideas in this like Tony Aluminum Foundation and other stuff. It's a bit different. So you can develop yourself when it comes to this aspect. One of them is your confidence level. 2 is how you present your slide. 3 is how you also talk about what is in your slide. It's not everything you start reading word for word. You just have to pick the basics or pick the main points and then drive it. And you should also know the major parts of your presentation that you have to stress on. For instance, in medicine, you must actually stress on the pathogenesis and the treatment. So the other epidemiology, introduction, other parts, you might not really spend much time. When you get to pathogenesis and the treatment, you have to spend more time when it comes to medicine. Also, when it comes to things like this, when you get to stakeholders, those are things that you have to stress on, because we are trying to make a picture of your audience to be one of the stakeholders. So when you also get to probably a bigger audience, where you probably have to pitch an idea, you have to know where their interest lies, and then you have to dwell more on that part, because most of the time, your time will always not be enough to present. But if you're able to hit the nail on the head at that particular point that interests them most, I trust you actually make a very good success. Okay, SCOPI 10, you signified, I think, let me let you proceed with your presentation. I'll make you the co-host now. So I think we'll pass on score 08 that was supposed to present. I don't know how come SCOPI 10 didn't present earlier on. Sinachi David, are you here with us? Please, if David, if you can hear me, just unmute and reply.
Hello, are you hearing me, sir?
Yes. So you are supposed to present.
Sir, actually, I've been working on other things. That's why I was not been able to produce a slide. So, and two, my group members are not active. It's only one, and the one that is active, I called her. She's not picking her call. So I don't know if it can be possible next week, sir.
All right. Okay. First of all, sorry for having for being in this kind of situation where you have inactive group members. I think it would have been best if you have actually reported them earlier, and then we'll find a way to actually address them before this particular presentation. Secondly, right now, today is the only day for presentation, and if you miss today, there is no makeup presentation. Next week, I think next week you are going to have your assessment, and then the final result will be out. So there is no other window for presentation. I was even thinking based on your environment a bit noisy. I was even thinking based on your a particular situation. Probably if you don't have a slide, if you could just present to us and then we could listen to you. But it looks like there's nothing on ground for us to actually build on at all. Or can you just work something out and present something that you have written down, even if you don't have the slide?
Okay, can I send it to you on WhatsApp?
No.
If
you can't present it now, I think you have missed the opportunity.
A busy place.
Well, you should have completed earlier on to when the schedule was sent out, and then you will have been rescheduled probably for evening or for morning session.
Sir.
You understand? Thank you.
Yes, sir.
He should prepare for the evening session if we have time. If he's lucky enough to we get a slot for him there. Other than that, there's nothing we can do.
Okay, sir. Sir, the evening session, can it be by let me say 8 p.m.?
David, you're so funny. Oh God, David. Is it that you didn't see the schedule of the presentation first of all?
Sir, I saw it. Actually, I saw it. But
did you see the time there for each
presentation? My group members should be working on it, but no, sir.
Okay, well, there are timings for it.
I didn't see, sir.
You didn't see. Well, I think one thing that most of
I only saw afternoon.
You participants have is you most of the time don't check your group very well, and whenever they send message to your group, you don't really digest it very well.
I opened it, but I didn't check the evening part because my own part falls in the afternoon.
Okay. Well,
okay. We've said what we can. What we can do for you is that you can fit in yourself in the evening session. Then that would work. Other than that, God will help you.
Okay. Thank you, sir.
Evening section is from 6 o'clock to 8 o'clock, please.
Okay, 6 o'clock. Okay. Thank you, sir.
So
thank you. I will work on that.
And please message. Who is your group coordinator?
Yes, I am the group coordinator.
No, as in.
But Esther is like she's with me, but the other two.
Okay. I mean, your coordinator for the whole SCOPI.
Okay, for the whole SCOPI.
I'm the coordinator.
Yes.
I actually wanted to ask
our chief director, SCOPI director, Victor Elekwachi. I know the way you asked me, it was so confusing. That's
right.
It is you now.
In medicine, I think I've seen people that
and Ebogade Daniel is also the also following
the stuff that I don't need to pour now.
Review the
anyway. David, you message Victor to tell him that you would like your time to be moved to 6 to 8 o'clock so that he will put you on the schedule for 6 to 8 p.m.
Okay, okay, sir. So
All right.
I'll be here by 6 o'clock.
Well, if you have another
Thank you,
place
sir.
to be, well, you should be here by 6 o'clock.
All right, so is that all? Are we done for this session?
So,
all right, so well done, Chief Daniel.
Okay.
Thank you, sir.
Thank
So, thanks, everyone. Yeah, I'm with you, sir.
Okay. So well done, everyone. Well done. We had quite an interesting session this afternoon, evening. I hope the next set would be more interesting, and then that people, it's easy somehow. These things are not so difficult. If you're able to attend a session, maybe the morning session, if you're to present in the evening, it's only wise for you to attend the morning in at least 1 or 2 sessions, listen to some comments, then you can apply them by evening, but some of them don't get these things.
Yes.
Anyway, it's fine. I did some of them, so I think we just have to wait for the evening session. Thank you very much, everyone, and then Chief Daniel, thumbs up.